Lockdowns across the country have been saving lives, but they've come with their own health costs. We should be clear about this, right? For instance, the Washington Post points out that many doctors say the pandemic has produced a silent sub-epidemic of people who need care at hospitals but dare not come in. And then there are the real effects lockdown has been having on people's mental health. There's been a documented increase in domestic violence. People have been drinking more alcohol, which is perhaps not that surprising. We already know that being alone is very, very detrimental generally to people's mental health. And add to that the incredible disruption that everyone's going through, from financial crisis and unemployment to grieving the loss of loved ones and not being able to come together and memorialize them, and then having to internalize all the stress of the disruption. All that adds up to a very difficult time for people and their mental health right now. Here to talk about what can be done is Bill Smith. He's founder of a new organization called Inseparable, which is dedicated to mental health advocacy. Bill, I'm curious what your view is and what your organization has sort of seen and heard about where folks are in terms of their mental health during this crisis.
Well, thank you so much for having me, Chris. And indeed, we have a crisis within a crisis right now in our country. We had a mental health crisis before the pandemic started. We had dramatic increases in deaths of despair. We had significant numbers of Americans saying that they were having trouble with mental health. And that's only escalated in this crisis. And that's why we started Inseparable. It's based on a pretty simple premise. Health is health, and the health of our minds can't be separated from the health of our bodies. And we've been taking our mental health policy as too much of an afterthought in this country. And right now we're seeing the effects of that.
Yeah, it's striking what you just said. I mean, one of the sort of, we've covered this on the show and also on my podcast, Why Is This Happening? One of the most sort of striking aspects of American life over the past 2 years and past 3 years was even at a time of good macroeconomic growth, low unemployment, and relatively high annual growth and expanding economy, you actually saw American average life expectancy declining for the first time since basically war years. And that was largely driven by things like substance abuse, overdose, and suicide. So even in the best of times, America has had recently quite a really acute problem in addressing people's mental health needs.
That's right, Chris. And the system, it's not been doing a good enough job of taking care of those people. Mental health care should not be a luxury in this country, but for many it is. If you think about it, if you have a heart attack or a broken arm, we don't say we'll get back to you in 3 to 4 weeks, come in later. But that's what happens all the time to people in this country around mental health care and worse. And so that's what we just think we need to do much better. That's why we formed Inseparable, is to create the pressure needed on our political system to demand better mental health policy that allows us to all take care of each other better.
You know, I was thinking about the sort of mental health challenges people face right now in the midst of the pandemic, which I think have expanded in many ways. And there's an analog, I think, to the way that we think about the pandemic, which is there were these projections of what would happen if we did nothing, right? If there's no interventions, maybe 1 million people would lose their lives. If we do things like shelter in place, reduce mobility and physically distance, we can bring that number down. There's something similar right now with mental health. It doesn't have to be the case that we see an enormous wave of suicides or overdoses or things like that in the wake of this, if there is sufficient intervention from a public health standpoint to give people the treatment they need right now as we sort of reopen the economy, to keep our eyes on that as well.
That's exactly right, Chris. And, you know, the thing about projections is they don't have to become a reality. We have power to do something about that if we start taking mental health care policy seriously in this country, and that's what we're advocating for.
Bill Smith, you're one of the co-founders of Inseparable, an organization that I think is going to have its work cut out for it, but be really, really important going on. Thank you so much for having some time with us tonight.
Terrific. Thank you so much for having me, Chris.